For those of us just joining on the recording, hello and welcome to the Age-Friendly Communities Movement in New Jersey, past, present, and future, hosted by the Hub for Aging Collaboration at the Rutgers School of Social Work and New Jersey Advocates for Aging Well. It is my pleasure to introduce Dr. Emily Greenfield, professor at the Rutgers School of Social Work and director of the Hub for Aging Collaboration, to start us off with welcoming remarks. Emily.
Thank you so much, Natalie, and thank you everyone for joining us this morning. Happy May 1st. You made a great choice of starting off your month of May 2025, Older Americans Month. With all of us here at this kickoff celebration, we're so pleased to create this virtual platform where we can all come together and share our voices and take stock in the age-friendly communities movement in New Jersey, past, present, and future. I just want to highlight quickly that this is the kickoff event that we're hosting, New Jersey Advocates for Aging Well and the Rutgers Hub for Aging Collaboration in the School of Social Work in honor of Older Americans Month, which is a national event with leadership from the Administration for Community Living that picks a theme every year to celebrate something that recognizes the contributions of older adults, amplifies attention to our aging society, and showcases the critical supports and the ways in which we all are interdependent on each other as we grow older. So this year's theme, Flip the Script, is this is from the ACL website, focuses on transforming how society perceives, talks about, and approaches aging. It encourages individuals and communities to challenge stereotypes and dispel misconceptions. This year, join us in honoring older adults' contributions, exploring the many opportunities for staying active and engaged as we age, and highlighting the opportunities for purpose, exploration, and connection that come with aging. And just want to say, what better way to honor this sentiment by really taking a moment to amplify attention to our age-friendly communities progress happening across our state's diverse communities. Okay, so we're thrilled that over 170 people registered for today's webinar, and we're equally thrilled, not just the quantity, but the qualitative mix of people who have expressed interest in coming together on this occasion. We have various sectors, you see in this word cloud, government and nonprofit, highly present. We have people who do work from across the state of New Jersey, northern New Jersey, central New Jersey, of course, a contingent from higher ed. Really just pleased to have everybody come here and want to celebrate that as well. So yes, so the purpose is to celebrate the evolution of age-friendly efforts in New Jersey, and equally important, explore exciting new developments for progress from the perspective of New Jersey age-friendly champions. All right, so here's what's in store for our time together. Our first segment is going to be from Julia Stumbos and Rini Carniel from Private Philanthropy, who are going to present on the catalyst of so much of this in our state, their pioneering grant-making program that really birthed the formal movement and accelerated it to where we are now. Then we'll have a panel of age-friendly leaders led by Dorothy Sanders, who will share their reflections on age-friendly community work at the local level. Then we'll have a segment on scaling up and spreading out with some highlights from our research team. We have Melissa Chalker from New Jersey Department of Human Services, Division on Aging Services, talking about exciting new developments coming out of Trenton. And also Kathy Rowe from New Jersey Advocates for Aging Well, talking about Lifelong Strong New Jersey as a real new development. So stick around, all good stuff. Then we're happy to have Katie Squires from AARP New Jersey, who will offer some final commentary. Then we'll have question and answer at the end. Again, we're going to save questions for the end of everybody's content, but we really encourage you to go ahead and use the chat to ask questions throughout and have that be a dynamic space where we can have some discussion as well. And our announcements and adjournment within an hour and a half. Okay, so I just want to say up front, thank you so much to everyone who is taking the mic as part of today's program. And again, thank you all for joining and for your full attention and participation here. And with that, I'm going to go ahead and hand the mic over to Julia and Rini for their presentation.
Okay. 1 second. Good morning and welcome to our session, Improving Communities for New Jersey Aging Populations Through Collaborative Grant Making. I'm Rini Carniel, Executive Director of the GRATA Fund for Older Adults.
And I'm Julia Stumbos, the Program Director for Aging in Place at the Henry and Marilyn Taub Foundation. We're going to share some information about how our two foundations' investments helped to launch the age-friendly movement in New Jersey.
As two very different funders, we began this journey by agreeing to common approaches to funding and common aims. Our primary goals were to spur the development of individual age-friendly communities and form a network of community leaders. In addition, we sought to have regional impact of this work. Another common vision was to learn and assess how this work would unfold differently in each of our regions and communities, since the Taub and Grotta foundations serve different counties, mine including Essex, Union, Morris, Sussex, and parts of Somerset counties, and Julia's in Bergen and Passaic counties. Together, we began exploring age-friendly work that had already occurred in Montclair and Princeton, as well as the progress in Massachusetts, New York, and AARP's network of communities. In addition to these goals, we agreed to try to change the negative images associated with older adults. We identified and sought to instill the principles and tools of an initiative called Reframing Aging. Reframing Aging offers ways to counter ageism by changing language, images, stories, and even birthday cards, much aligned with this year's theme of Older Adults Month, which is flipping the script on aging, as was mentioned. We developed a common application and initially funded planning grants, which enabled grantees to spend time surveying and evaluating their communities and set priorities for multi-year implementation. Input from local residents and diverse stakeholders helped to inform the implementation phase. An added benefit of this community outreach was the creation of partnerships to work together toward bettering the communities. While Grotta tended to provide seed funding to most grants, we discovered that we needed to fund this work much longer than expected. This long-term multi-year investment is resulting in stronger, deeper, and broader impact as the work has now spanned into various sectors such as health, transportation, housing, built community, and even public health, which was critical during the COVID pandemic.
So at the onset, we also knew we wanted to form a learning collaborative, making time and space for frequent peer-to-peer collaboration with opportunities to benefit from expert speakers. A body of knowledge was being created in real time, and Rutgers was funded to do participatory research in-depth interviews and provide feedback that advanced and supported this community of practice. The collaborative group has enjoyed celebrating collective accomplishments, as well as evaluating things that did not go as planned, and always valuing the time spent together and the energy that results from working in a group with shared goals. This has been a continuous learning experience for all of us, a deeper understanding, as Rini noted, of what it takes to create and sustain an age-friendly community has been gained along the way, and it's more an interactive type of grant making. Something we're really thrilled to see is that the age-friendly community core teams have been invited to present their process, their successes, and what they've learned at conferences, becoming ambassadors for the movement, and creating guides and toolkits and getting the word out, which is really one of the factors that has fueled this as a movement. We realized early in the process that to embed these outcomes we all wanted to see, we would need to influence more than just the local community. Grantees were part of an ecosystem and needed to expand the sphere of influence. So they began sharing tools between local, county, and state leaders. And it also became clear we would need policies to support age-friendly community growth and vision for the long term. So we saw what other states were doing to get a longer commitment from the highest levels of leadership, and our ambassadors started to advocate for the same thing in New Jersey. And so these are the elements of the early beginnings that launched this movement.
Our first joint endeavor was to hold a high-leveled educational and energizing conference on age-friendly communities, led by national leaders who are experts in the emerging field of age-friendly communities. We educated local community leaders and our boards about this work. Our first round of funding went to 9 municipalities and nonprofit organizations, and 8 moved forward with implementation grants.
These communities were in the middle of implementation when everyone had to shift to crisis management with the COVID pandemic. We saw how important it was to be flexible with the grant making and expectations and encourage groups to alter their original implementation plans accordingly and to engage support from the multi-sector partnerships that had formed. This resulted in a coordinated response to the specific challenges for older adults at that time, like food distribution and immunizations and communications.
Then in 2021, we held another conference. We continued our support to our communities and deepened our partnerships with Rutgers. With their School of Social Work staff and research team, we were able to provide more advanced educational sessions and shared much of our effort through virtual conferences. We adopted a logo and identity of our collaborative, calling it Age Friendly New Jersey, and broadened our involvement of interested municipalities and organizations to join this community of practice.
Throughout this timeline, the process of learning and doing has helped to cultivate strong community leaders. The close partnership with Rutgers and contributions by many nonprofit organizations around the state has strengthened new networks for knowledge sharing. And we as funders take great pride in the fact that the age-friendly community leaders have been invited to share their knowledge and recommendations at the state level. You'll hear more about that today, which is extremely fulfilling. Our cohort in New Jersey also captured many opportunities to replicate the successes from other states and to contribute to the broader body of knowledge on age-friendly communities. In fact, our efforts to keep New Jersey abreast of best practices around the country and to be invited to contribute to them as well led to the pursuit of something even bigger, a multi-sector plan for aging for our state, which I'm not going to give away much information about that. You'll hear more later. But it really is an important part of the arc of this movement, looking back from where we started to the present and to the future we envision ahead. So these are some of the publications from the research team at Rutgers School of Social Work, led by Dr. Emily Greenfield. There are links to the entire body of research on the Hub for Aging Collaboration website, which someone from the team can put in the chat for your reference. And please check those out to learn more.
Beyond 2023, great strides have been made by bringing together various statewide collaborators to focus on state planning, policies, and advocacy. We pushed for the state to become an age-friendly state. Members participated in the process of creating the state's blueprint for age-friendly communities, as Julia mentioned. Our age-friendly leaders and Grata testified to push for state funding to be directed to expanding the age-friendly community movement. With our support, New Jersey Advocates for Aging Well is now instrumental in current efforts to continue engaging with age-friendly leaders, recruiting more collaborators, and now looking to the next governor to address the future of aging in New Jersey. The continued efforts of the original cohort of age-friendly leaders is critical to the future as well.
And just to say a little more about the age-friendly leadership projects that are happening now, we have wonderful examples from Garfield's age-friendly policing leadership and public health social work liaison. In Bergen County, the stakeholders are meeting and learning together regularly through the Bergen Roundtable. Community leaders from age-friendly Ridgewood have produced a municipal guide that any municipality can use to launch their own programs. Age-friendly Englewood's coordinator has been a leader in climate disasters and impact on older adults. The list goes on and on. We have an age-friendly housing guide produced by the Supportive Housing Association, and an age-friendly primer, if you don't have enough documents already, is in the works from New Jersey Advocates for Aging Well. Plenty of resources for everyone to use to get started on their work. And TNAC has also been a stellar example of coordination with city planners and elected officials to create housing, to engage with the community, and to create intergenerational programming as well. All of this collective expertise is what led the state to select some of our age-friendly community leaders to participate on the Governor's State Advisory Council to make recommendations for the blueprint. We're very proud of that.
Before we close, we wanted to share a few personal reflections and the outcomes we're most excited about. From a funder point of view, our collaboration spurred outcomes well beyond what we originally envisioned. both with the grantee accomplishments, the research and contributions to the movement, and now expanding the influence beyond just communities to the statewide level and beyond. We are proud of the fact that we were able to amplify the voices of community members along with municipal leaders, creating communities that are dedicated to aging and ambassadors. We're proud of the work that was actually accomplished by our communities involving walkability studies, other safety studies and improvements, and structural changes in the environment to form a safer environment for older adults to grow up and grow older.
I think we're getting the signal to wrap it up, so I'm going to rush through the end. Philanthropy cannot fill all the gaps from public funding. That's going to be more and more important to realize as we go forward. But we can pilot and show proof of concept and then hope that larger powers take it and run with it, such as what is happening in the state of New Jersey now. But to be successful, we need a lot of relationship building. There are opportunities to embed plans for aging at every turn. And we are aiming for more public-private partnerships, which is a key ingredient for success. It's an aspirational goal for us to create more of those. But we really are hoping that our push for the next governor to commit to a long-term multi-sector plan for aging will be another opportunity to blend public and private funding and build something lasting and impactful. And we have welcomed Parker Health Group in our work towards that end. But we also hope other funders around the state will see themselves in this work and will contribute to making New Jersey a state we can all age well in.
Both of us are available for questions and more information. And now we turn the program to Dorothy.
Oh, Dorothy, can you unmute?
There we go. Thank you so much, Rini and Julia. That was a great overview, and we really appreciate it. So my name is Dorothy Sanders, and I'm the age-friendly strategist with New Jersey Advocates for Aging Well. And I'm very excited to moderate this upcoming panel in their own voices, reflection from local age-friendly leaders. As you know, the burgeoning age-friendly movement began about 13 or so years ago as the AARP launched their AARP network of age-friendly states and communities. And age-friendly partners with age-friendly North Jersey, New Jersey NJAAW, RADA, Taub Foundation, Rutgers, and many others that you see on the screen all continue to support and learn from each other as we work to make communities in New Jersey more livable for people of all ages, especially older adults. Our panel is comprised of 3 very exciting age-friendly leaders with community initiatives in the Garden State at various stages of their age-friendly journey. We'll have 3 panelists that'll have about 5 minutes or so to share their thoughts and reflections, their unique beginnings, their experiences, their grant sources, thoughts and insights with respect to their age-friendly journey. And it's going to be a powerful addition to this event because they're bringing their passion and they'll talk about their experiences in their own voices. And we'll start this off. Let me just tell you who the 3 panelists are with E.J. Vizzi out of Teaneck, and then Olive Ross out of West Orange, and Ellen Healy out of Leonia. And collectively, they've been in this age-friendly journey for about 16 or so years. EJ started in 2016. West Orange started 5 years ago in 2020. And our most recent member of this group is Ellen Healy of Leonia, who's less than 1 year old in her journey. So please, without further ado, I introduce you to EJ Vizzi of Teaneck.
Thank you, Dorothy. Can everyone hear me fine? Wonderful. So again, my name is EJ Vizzi, and I am with Age Friendly Teaneck. We have been part of the Taub Foundation's first cohort. In 2015 is when we did our first needs assessment, and then 2016 we launched. So we've been doing this for just about 9-10 years, which is kind of crazy to think about. We were the first municipality in Bergen County to become designated from AARP to be part of their age-friendly network, so 3rd in New Jersey. So it's been a lot happening over these past 9-ish years. I have 5 minutes to talk, so I really thought that I can condense this in a way that would maybe be helpful for those at the call. So I kind of wanted to talk about some lessons learned and maybe some advice for up and coming communities. So next slide. So lesson one is relationships matter. We've learned the strengths of our partnerships, whether that's internally within our teams, externally. You can see some familiar, friendly faces in these pictures, across local government, regional government, houses of worship, libraries, civic groups, and of course, the residents themselves. And it really has made all the difference. You know, the common adage of it's not just who you know, but what you know, or it's not just what you know, but who you know. But it's really what you do with who you do it with and how well you keep those relationships over time. So focusing on programming can always be great. But it's really the power of staying age friendly lies in the collaboration and the rapport you build with the people during those events to really optimize advocacy. And it has helped us really to kind of make a name within our municipality and our region. And as Lucy mentioned earlier from Julia, that we've also been able to develop buildings. So, you know, always thanking those who are on the team with you. You can see on the bottom right, we just had a meeting with our advisory board yesterday. So we already started flipping the script for Older Americans Month, but always thanking those who support you, whether in kind or financially. Next slide. And lesson two would be that flexibility is a core feature, not a backup plan. I don't mean that only for exercise, though of course that's always important too. You can see on the right-hand side, our township did build out this exercise area for those who have disabilities. That also is helpful for people who are older adults and anyone who wanted to use it. But with flexibility, you know, COVID really taught us to adapt quickly. And long before COVID, we learned that needs change, and being age friendly means being responsive, not rigid. So what worked 5 years ago or 9 years ago may not be what is working for older adults now, at least in our community. So we've definitely adjusted items on our action plan and eventually sometimes abandoned items. We've put things on the back burner until the local government or the zeitgeist of society brings it forward. Something that comes to mind for me is ADUs, so accessory dwelling units. That was on our wish list 9 years ago, but it really was only something we were able to address in the past 2-3 years. So always keeping things in mind, but staying flexible and remembering that you have to work with what you have. So to our newer communities, really building adaptability in from the start is very helpful. So it's not just forced upon you in a crisis. Um, and something I always like to bring up is in the very beginning, when we did our needs assessment, we did the backronym of TLC. So we were calling ourselves TNEC as a livable community, and we thought that was going to be great and it was going to launch forward. But when we did surveys, you can jump to the next slide. We really spent time gathering the data, and we learned that livable communities was not something that people understood no matter how much we explained it. So we rebranded. We're age-friendly TNEC. And that was really something that our former project coordinator, when she was talking to not just people within our community, but other people who had started this in the first cohort with us, maybe age friendly is going to be the household name that we're going to stick with. So we definitely spent time gathering data, doing surveys and reports, which of course were useful, but those numbers needed us to give them a voice. And so what has been helpful was um, you know, having the real conversations, hearing people's stories and building insights that maybe a report couldn't do. And some of the best ideas genuinely have seemingly come from mundane chats with people. So it can be easy to get caught up in assessments and the numbers and the checklists, but maybe it's a social worker in me talking, but keeping the data human emphasizes the balance between evidence and empathy and really invites a more community and age-friendly approach. So that's just stuff I wanted to share with you guys. You know, I wanted to point here to the left. This is a data point that we like to highlight all the time. And you can see we use it regularly, but I kind of stopped around the 2017 time because it's having those conversations and being at those outreach tables and seeing people in the community that has really sparked our innovation. So if you have any questions, you can always feel free to reach out to me. Next slide. So here's my email address. You can always check out our Facebook. We're doing a challenge for Older Americans Month right now for flipping the script, to share any data, any media, TV, movie shows that you wanted to. So help us join the challenge. But I'm going to pass the microphone over to Olive with West Orange now.
Can you unmute?
You muted me, sorry. I'll start again. Good morning. My name is Olive Ross, and I am the Senior Livability Coordinator for the Township of West Orange. I've only been in this position a little over a year, but I thought I would begin by giving you a little history about the Aging Well West Orange initiative. Next slide. So in 2017 is actually when our age-friendly initiative started. The West Orange Department of Health received a grant from the Partners for Health Foundation to implement the West Orange Senior Livability Initiative with the mission to create an age-friendly community in West Orange. Also during that year, we conducted a West Orange survey for older adults and received a lot of helpful feedback on future plans and various township programs and services. In 2019, a senior livability coordinator was hired, and that was our own Dorothy Sanders, and the Senior Livability Initiative was implemented. A senior coalition was formed between the West Orange Health Department, the Department of Senior Services, Recreation Department, and West Orange Public Library. And programs were developed to help assess and address the transportation, communication, social, mental health needs of our older adults. Then in 2020, West Orange was formally accepted into the AARP and World Health Organization's global network of age-friendly cities and communities. Next slide, please. Then in March of 2020, the COVID pandemic hit. And while the pandemic did not prevent the West Orange Health Department and Department of Senior Services from moving forward with the initiative, it did underscore the need for innovation and partnerships. So as a result, a 7-town regional coalition was formed and focused on assisting residents with urgent needs, such as acquiring everything from food deliveries to masks and vaccine appointments. We also addressed the technology needs of our older adults with instructions on how to Zoom. We implemented COVID food insecurity strategies and partnered with restaurants and local pantries. The West Orange Department of Senior Services also stepped up its programming to encompass an array of events related to health, education, wellness, and individual resources as appropriate. Our intergenerational connections occurred, and we provided programming across the generations. And we expanded our collaborations with Montclair State nursing students and promoted physical and mental wellness. Next slide, please. In 2024, which is when I actually came on board, West Orange was in the process of developing its action plan for becoming a more age-friendly community under the criteria established by AARP. This was actually a very good point for me to come into the process because as I went through the exercise of creating the action plan, I had to delve into what was the current state of our initiative, what areas needed development, and what were our overall goals. One of the key things that I identified during this process is that the age-friendly movement was not top of mind internally or in the community, and that there were a number of competing priorities. So it became my priority to build awareness around the age-friendly movement internally and in the community. And with the support of a grant from the Grata Fund this year, we launched the Aging Well West Orange campaign, and the goal is to advocate for an age-friendly community, age-friendly mindset internally with our township leaders and departments through education, discussion, and information sharing, and to build community awareness around West Orange's age-friendly status, what it means to be an age-friendly community, ageism, and reframing aging through a number of community engagement events. Next slide, please. So my hopes are that once people are aware and understand the importance and the benefits of being an age-friendly community, that we can integrate the 8 domains of livability into our policies, our practices, our programs, and priorities township-wide. We want to really ensure that public spaces, transportation, housing are accessible, safe, and conducive to healthy aging for older adults. We will continue to improve upon all the wonderful age-friendly programs that we currently have in place, and to develop a strategy to ensure that these age-friendly efforts are sustainable and adaptable to changing community needs. And most of all, we have to celebrate our successes. Sometimes the task of changing people's mindsets and priorities can be somewhat challenging, and we don't recognize the progress that we've made. Therefore, it is important to celebrate whatever successes we have obtained to date. Next slide, please. And our key message is aging, everybody's doing it, and West Orange is aging well. Thank you. That's the end. Oh, and I'll turn it over to Leonia now. Thank you.
Thank you, Olive. Hi, my name is Ellen Healy, and I'm the chair of the Age Friendly Leonia Advisory Committee. As Dorothy explained, we are new to this whole project, and it has been an education, and a really wonderful education for myself and for the people who have been involved with this. So our next slide, please. So first, I think I'd like to tell you a little bit about Leonia. We are a small residential town in southeast Bergen County. We have a very diverse population. We have about 9,300 people living in town. And you know, when I look at it, 36% of the residents are 55 or older, and that's our target group for the survey that we'll be doing. 40% are between 20 and 54, and then 24% of the residents are younger, 19 years or younger. Our demographics are interesting to us, and hopefully to you also. We have 42% Asian, 38% white, and 18% Hispanic or Latino. So we are a diverse and multicultural community. We're happy to be that, and our goal in Age Friendly is to make sure that we are listening to all the voices in the town, and not just, we don't want to miss anyone. We want to make sure that the survey is accessible and that there is support for anyone who would like to take that survey. So that's going to be our first challenge. Next slide, please. So we started, the person who actually brought the idea of Age Friendly to Leonia is Maggie Brown, who is our senior coordinator. She's the one who floated the idea with our mayor and council and helped them to understand that this could be a very positive thing to happen in Leonia. And it's funny how one conversation leads to another. And, that's sort of how things unfold and have unfolded for us in Age Friendly. So in the summer, I met with Janet Sharma, who helped us to understand a bit about where we could get started. And then she introduced us to Kyung-hee Choi, who was a wonderful help to us. And one of the first things she said is, you need to first bring together the leaders, both of the Korean community in town, as well as the government leaders. And so we did that. We did that in September. While we were planning that, we were also bringing together our Age Friendly Advisory Committee. And it seemed to me that one of the things, in all towns, there are so many things that happen, so many committees, commissions. There's always a lot going on in a town. But the key, I think, is figuring out what's going on in each area. How do we develop communication? How do we learn about what's going on in various aspects of town? So what we did is, as we were inviting people to join the advisory committee, I was determined that people would also be involved in another area in town. So our committee of 12 people now, we have the health educator in our town. We have someone from the Board of Health, from Community Chest, from the Recreation Commission, someone on the library board, someone on the sculpture committee in our town. I'm on the Race and Equity Committee. We have members from different faith-based groups, Holy Name Hospital, and Senior Services. So what happens for us is that that group that's focusing on age-friendly brings the age-friendly perspective and voice to each of those other committees in town. And we're feeling like that's a really strong bit of foundation for us to do. We did bring together the leaders of the various communities in town, and that started a lot of conversations. And that's been growing and continuing, and a really important part of the work that we're doing in our very early stages. When we worked on the grant this summer for the Estate Age Friendly grant, that helped us really define how we wanted to be inclusive in our approach. We've been attending the age-friendly webinars, the Northern Jersey Roundtable. We are just trying to learn anything and everything we can. And there's so much to learn when you first start in age-friendly. We've been inviting speakers to come to our monthly meetings. EJ came and talked to us about TNEX Startup. We actually had our library director come, and we realized there were going to be a lot of opportunities for us to collaborate with her and with the things that are happening at the library. We had Rachel Rebish, who was born and raised in Leonia and continues to now works for the county. And she came and talked about senior services in the county. So we're trying to make sure that every time we come together, we have an opportunity to learn something more. And we are sharing information about what we're doing among the various organizations. Next slide, please. So this weekend, we are going to have a table at Leonia Day. We're going to do a quick pulse survey with our older adults to just get a sense of what they're thinking right now as we get ready to do our survey, probably very early in the fall. We'll also be at a wellness fair and doing the same thing a little bit later this month. We're in the process of hiring and onboarding a part-time age-friendly coordinator. We're finalizing our community needs survey. We're planning the survey rollout and some events to make sure that we really get good participation. And we're meeting with other groups to share information. And we're taking advantage of every opportunity that we have to learn. We had 2 people from our committee who went to the transportation symposium. They came back with all sorts of ideas. This month, we're meeting with our town transportation and pedestrian safety committee. And already there's a little bit of chat happening about, are there things that we can collaborate on going forward? So everybody tells me that once we get started, things will start to happen. And I think we're beginning to see that. And if we can just go to my final slide, please. So this, there we go. So one of the very early lessons that I had was when the New Jersey Advocates for Aging Well put out their request for photos for a contest. I was sad, when you look at EJ, she's got all those great pictures to show, and we're not quite there yet. But we do an awful lot at our senior center, and we have so many active participants. So at this one class, I said to them, would you like me to take a picture? We can enter a contest. We had no thought that we would ever win, but we thought it just sounded like a fun thing to do. So we took that picture and sent it off. And then I got a little 3x5 for everybody who's in the picture. Well, if I had given them $1 million, they couldn't have been happier. And one woman who asked me for 3 copies of the photo hung one in her bedroom and sent the other 2 to her daughters to show what an active and engaged older adult she is. And she said to me, I bumped into her last night at something, and she said to me, she said, every morning I look at that photo and I smile. And I think, what a great way for us to start. We haven't gotten into the big heavy duty work, and we're going to get there. I believe we will get there. But there was so much goodwill engendered with that one photo. And that was a big lesson for me to learn. So thank you very much.
Great. Thank you so much, EJ, Olive, and Ellen. You've done a great job sharing your different journeys. One thing that we see as a common denominator is your passion, your commitment, the collaboration, your zest for knowledge and learning from each other. And we are all here to support you in that journey. So with that, I will turn the mic over to Emily Greenfield.
Thank you so much, Dorothy, and thank you for all of your voices. I don't know about you, but like I could just spend days listening to people talk about their community's age-friendly work and what it means to them and their communities. And effectively, it's such a privilege being a professor, doing research, engaged research with all these wonderful leaders in New Jersey to kind of do just that. A lot as my own day job, which I'm really happy to take a few minutes to talk about the ways that we all have been building knowledge together on age-friendly community practice, rooted in the experiences of our journey here in New Jersey, but disseminating this work both locally and way beyond as part of a national and global movement. So I can't summarize, 10 plus years of work in 5 minutes. I'm just going to give you a really high level overview and taste and encourage you all to look more into it as it suits your needs and your community's desires. But stopping for a moment and thinking really big picture, I just want to take a moment to recognize that age-friendly communities and age-friendly as a movement is really something unique to the 21st century. It is our century's moment of a paradigm shift on aging. If you think about it, the term age-friendly didn't really come into like popular parlance until 2001 with the World Health Organization leading work on active aging and healthy aging starting then and starting to promulgate the use of this term. Really took off in 2007 when the World Health Organization published its guide for age-friendly cities and then formalized its global network of age-friendly cities and communities in 2010 as kind of a programmatic on-ramp for communities that wanted to take action in response to this guide. In 2012, AARP, as the U.S. domestic lead of and partner of World Health Organization, formalized its own parallel network of age-friendly, now called the AARP Network of Age-Friendly States and Communities. And then in 2014, 2015, we had our pioneers in Montclair and Princeton, New Jersey, as the first early communities to join the AARP network, which led the way to the grant-making program that Rini and Julia so wonderfully described to all of us, starting in 2015, 2016, which I kind of grayed that out. It was like the initial seeds of what we now call age-friendly in North Jersey. But to the credit of how social innovation takes time, that structure really evolved out of some earlier years of work together and cross-sectoral collaboration led by private philanthropy. So in terms of our age-friendly research team at Rutgers, as our State University of New Jersey, we've had a lot of outputs that we're proud to share that builds knowledge and practice on age-friendly communities. And one of those outputs most formally is age-friendly North Jersey, really recognizing that there's amazing work happening at the local level, but that local work doesn't happen in isolation, and really to create a robust ecosystem of people leading age-friendly social change, you need to create more intentional relational structures, communities of practice, network opportunities at multiple levels. And so over the years, we helped build what we now call age-friendly North Jersey. We've done a lot of presentations, both academic and non-academic. We've created reports. Rini and Julia, thank you for highlighting those, and they're on our website. And I would say importantly, we've also elevated this work for peer-reviewed academic publication. And this is strategic, right? Of like trying to give voice, space, and gravitas to the work that you all just heard from our wonderful 3 leaders presented today, that this is strategy, it is theory, it is action, it is connecting the dots and really trying to showcase the power of that work and the need to invest in that work by formalizing a field, basically, of research on age-friendly community practice through peer review publication. So everybody's invited to go to the website, our digital portfolio of work, and look at some of this. But just to kind of give you a heads up on what elements of age-friendly practice we've been building knowledge on together. One being the leaders, really early on, recognizing that human capital and social capital are kind of the key engine of age-friendly community change. You need good leaders, champions in multiple sectors working in combination with each other and building community capacity. Thanks, Natalie. And really being able to give voice to that. We've also taken a deep dive into the involvement of older adults in age-friendly community change processes, recognizing that the movement has always recognized that older adults should be central in change making, but really what do we mean by that? What does that actually look like? How can we encourage leaders to be more intentional in as older adult leaders themselves or partnering across ages to make sure that older adults are the change agents that the movement aspires them to be. We've also advanced work on the impact of age-friendly community efforts as well as their sustainability over the long term. Thankfully, the good fortune of having private philanthropic investment over such a long period of time has really been able to see what these community initiatives are able to do when given many years to achieve the long arc of change and make continuous progress. And then most recently, we've been focusing on how we consider issues of diversity and equity, recognizing that older adults are not a monolithic group. There's multiple dimensions of diversities, embedded systems of inequalities, and trying to understand from the ground up how age-friendly leaders attend to those considerations as well. I'm going to skip that slide for the sake of time, just say that moving forward, we're I wouldn't say we're just getting started, but we're by no way stopping, right? This is really the work of generations, and it kind of the idea is we're doing what we can with the resources we have, with the time we have, but hoping to really create something that's going to go beyond our lifetimes and beyond our here and now work in any given community. We're very committed to continue to advance this work within our great state. We're still active partners of Age Friendly North Jersey. We're part of the Lifelong Strong New Jersey Coalition that will be one of our final segments of content. We are planning to be involved with the New Jersey Department of Human Services Age Friendly Grants Program, which we'll hear about next. And also, I personally, in my own community of residence, am involved with pioneering a village in partnership with my own neighbors called the Glen Rock Neighborhood Network, which we just launched in April. That also relates to the national work, also wearing the hat of working with the Village to Village Network as a national nonprofit to support the village movement nationally as one approach to more age-friendly communities, partnering with California on their multi-sector plan for aging and their local grant-making program, and also doing a national research project now with AARP on how age-friendly leaders use digital technologies as part of their practice. So I just want to end with this quote. This is from Allison Barkoff, who's a former director of the Administration for Community Living, now a colleague in higher ed. If you're not following her on LinkedIn, I highly recommend you follow her. Her advocacy and perspective now in higher ed as a former ACL director, especially in this moment, is just so helpful. I attended the American Society on Aging conference earlier this month, and she spoke. And one thing she says that I think really sticks with me and resonates is, when we work together, we can do hard things. And clearly changing ageism, reframing aging, creating more, inclusive structures and supports for older adults and all their diversities, it's hard. It's a long game, but when we do it together, and we do it together more strategically and intelligently and harmoniously, we can certainly do hard things. And we've seen this through decades of work together, at least decade plus of work together in the Garden State. So I'll leave it at that and say thank you. And now I will turn the mic over to Melissa.
If I could find my unmute button. Thank you, Emily. I have to say it's an honor to be sandwiched between two colleagues, Emily Greenfield and Kathy Rowe, I think, who are obviously have had a huge impact on these initiatives. So thank you for having me today. As Emily said, I'm Melissa Chalker, and I'm the Deputy Director of the New Jersey Division of Aging Services. And I'm really happy to be here today to share some updates from the Department of Human Services. I'll start with a little bit of background on our age-friendly New Jersey journey, but I'll keep that brief because many of you are aware of that history, but just a refresher of where we started. But first, want to acknowledge that we wouldn't be here without the advocacy of this community and so many of you who are on this call today. I already mentioned Emily and Kathy, but Julia and Rini and many, many others who are on this call or part of this greater network. Thank you for all that you do to continue to promote this great work, because the success we've had here within the Department of Human Services in state government would not be possible without the advocacy efforts of all of you. So just again, a refresher of where all of this started. Back in March of 2021, Governor Murphy established an executive order calling for the creation of an age-friendly advisory council. Some members of that council are with us today, which called for the creation of an age-friendly New Jersey blueprint. And so from March of 2022 to September of 2023, we convened that group with monthly meetings, sub-work groups, SWOT analysis, subject matter expert presentations, and a public listening session. All of that work culminated in May of 2024 with the publishing of our age-friendly blueprint. Shout out to our friends in TNEC for hosting a launch event for us, and for the mayor of TNEC for allowing us to highlight our achievement there with all of you. We were joined at that event by our partners in state government who share our department's leadership vision of a more age-friendly New Jersey. Of course, we're also joined by our friends at AARP who gave us that stamp of joining the network as an age-friendly state, and we're grateful for that as well. And so after the release of that blueprint, we then launched in August of 2024 our age-friendly grant program with the release of the RFP for that. We received many applications, and through a long process of a Q&A and committee selection and all of the process that goes into that, those grantees were formally notified and awarded just last month. And so we're very excited for those first round of age-friendly grantees, which include 10 project grants and 17 community grants. So 17 more communities that are going to join this greater network of communities throughout New Jersey that have been designated as age-friendly. We're very excited for them to start their work. They've been onboarded here in our grant system within DHS, and we can't wait for them to get started. And we're not done there. Very soon, very soon, I promise you, a second round RFP will be released for more communities to apply to get a grant from the department to continue that work or to start work in their communities. And so what's next? What's next is, if you're following the state budget process, in the proposed fiscal year 26 budget, Governor Murphy has called for a senior wellness pilot grant. The focus and timing of this is yet to be determined. As you know, the fiscal year 26 budget has not been approved yet, but it's in the process. And so should that still stand tall at the end of the day, the intent is for us to use that opportunity to build on the age-friendly work and implement more initiatives from the blueprint. So stay tuned once the budget is finalized for announcements on what to expect in fiscal year 26 with the launch of hopefully another grant program focusing on senior wellness. We're also participating currently, which was alluded to, and I'll allow Kathy to say more about that in her remarks, but we are participating in the Center for Healthcare Strategies multi-sector plan on aging collaborative. We have, again, some other partners in state government that have joined us with that, as well as several stakeholders, some of whom are on the call today. to really advance that work. You know, we are extremely grateful for the Murphy administration and for the leadership on this, and that they've allowed our department to carry this work forward. What we hope in participating in that collaborative is that by working with partners, there will be an ability to lay some groundwork to make it easy for the next administration to further advance this work and potentially start the multi-sector plan process. So again, really exciting opportunities and a really energizing community. I have to say, as much as we feel success for the blueprint and the grant program, just hearing examples like Ellen's example of the participant who was so excited to share her photo with family and friends and how much it gives her personal joy. That to me is just such an inspiring thing, and why what we're all doing is so important. So just wanted to say thank you again for the opportunity to share with you our work, but also so exciting to hear about the great impact of all the work that all of you are doing. So thank you again for that. And I'm going to pass it on to Kathy to tell you more.
Hi, everybody. I am having computer problems today, so I'm going to rely on Natalie to share my slides. Thank you very much. So it is great to see everybody today. And I have to say that working with the age-friendly communities has been one of the most collaborative and rewarding professional experiences I have ever had. It is a great group of people who are all moving forward, very resourceful, and it has just really been an honor and a privilege to work with this group over the past several years. So next steps and moving forward, we are launching a campaign called Lifelong Strong New Jersey. And if you go ahead, next slide. Right now, we are a very active and involved group. Our steering committee is New Jersey Advocates for Aging Well, Parker Life, the TAAB Foundation, the Grata Fund, New Jersey Future, Fair Share Supportive Housing, and the Rutgers Hub for Aging Collaboration. So we all have deep roots in working together and in working to highlight the needs and help people age in place in New Jersey. Next slide. So what is our mission? We are an advocacy campaign to prioritize policies that ensure New Jerseyans can thrive in the Garden State. As you know, all older New Jerseyans are important contributors to the economy, the infrastructure, the communities. And as our demographics are rapidly changing, we want the next governor to recognize the increasingly older population and start including aging as an important consideration in all policy discussions, not just those related specifically to aging, but to open up the view and the conversation to all policy discussions so that we in New Jersey can become a better place to age well. Next slide. So our strategy so far is we are prioritizing aging in this year's governor's race. We are not lobbying, we are educating, and we're serving as a resource. We're asking all of the candidates to pledge to bring a lens related to aging in their policy considerations. And we're also asking partners and people to take a pledge to develop a multi-sector plan on aging. We're asking the candidates, but we're also asking our partner organizations and individuals to take this pledge. Next slide. So what is a multi-sector plan on aging? You know, I know we hear a lot of plans. There is the plan for aging that under the Older Americans Act, there are the surveys and the plans we were talking about with the age-friendly communities. But a multi-sector plan is different in that it is comprehensive and it includes all sectors of the economy. It breaks down silos. It takes a new and refreshed view, and it looks at the changing demographics and what we need going forward. Next slide, please. So what is a multi-sector plan? The best source is if you look at, I believe it's multisectorplan.org is a website which has a lot of explanations and shows what states are where in this progress. So New Jersey is about midway with other states. There are about 20 some states who have at least started the process. And as Melissa said, we're working with them also on a cohort. So parallel to this campaign is the learning cohort so that we are ready with the next administration, whoever they are, to move forward with a multi-sector plan. So it's a 10-year blueprint. So, it does have a long-term impact for restructuring how things are done. And part of this is state and part of this is local. And a lot of it is the intersection in between the two. It is cross-sectoral and is designed to create a coordinated system of care, support, independent living, social engagement opportunities, while also addressing the 8 domains of age-friendly communities. As you all know, aging is not a medical problem. Aging is not a transportation problem. Aging is not a problem. Aging is life, and it's a goal that we all strive for. So as states develop their own MPAs, and each one is going to be a little bit different based on our characteristics and our history and the politics, every state is moving forward to prepare for these changes and our older residents. Next slide, please. So again, this is separate from many other plans related to aging. An NPA sits in the governor's office. It's either designated by as a position, as a team, someone who reports directly to the governor in many states. It has a budget that supports its work, so it wouldn't be pulling resources from any other agency or department, like it wouldn't be pulling away or taking anything from the Division of Aging Services. It adds a unique funding stream dedicated to this, and it really is intentional with who is involved, the voices, the thoughts, the experience, and bringing it together. This is not a one-size-fits-all process. It's an inclusive process. Next slide, please. And this is a process that has a lot of opportunities. It can't be a plan that, the next governor releases onto us. It's something that needs the public-private partnerships for organizations and individuals. It's active, it's interactive, and it needs to look at things not just related to aging, but how aging affects different sectors of our economy, our businesses, our government, our structures, the way we do things. Next slide, please. And why now? With so many things that we're doing in aging, we're making such great strides with age-friendly work. Why do this now? Well, the advice we got from other states was, we have a governor's race. So now is a unique time that we have to bring it to their attention and prioritize aging. We've met so far with 6 of the candidates, and all of them understand that affordability is an issue for older adults. Well, for all New Jersey residents, for older adults. They are talking about housing options. They're aware of the property tax burden, and that is all wonderful. And a multi-sector plan will go beyond that. So it needs to be more than property taxes and prescription drug assistance. This is how we reshape New Jersey, because what we do to prepare for an older New Jersey isn't just the older individuals, it's their families, it's their children, it's the network of New Jerseyans connected to them. Like, one of the things we learned in this process is that 30% of childcare in New Jersey is provided by older adults, whether it's grandparents, whether it's a friendly neighbor, or people who work in the childcare industry, teachers, preschool. 30% of childcare is provided by people over the age of 60. So we need this plan. We need this integration in order to meet the needs of all residents. And like most of the country, our demographics are changing so quickly that within 10 years, residents over 60 are going to outnumber the students in our schools. And as Leonia said, they are already, I think you said 36%. Some towns are significantly older now than they were 10, 20 years ago. So now I'm not trashing schools, but now might not be the time to plan to build new schools. Now might be the time to look at what your schools need in 10 years when the population of students is going down, and what your older residents need in your community, and how we rethink and reshift our priorities and resources. And again, this is not competing for resources. It's not taking away. It's building better for the future. Next slide, please. So as I said, our New Jersey population is aging rapidly. In the last census, we saw that the demographics of older adults increased by 31%, where the whole population had increased by 5%. 2034, that tipping point that so many states are looking at, when our over 60 population is going to outnumber the students. That could very well be when the next person is elected governor. If they have 2 terms, they will be in office when that happens. And we know the challenges facing older adults. These are, largely what is covered in the 8 domains: affordability and appropriate housing, not just official affordable housing, but housing that is affordable and appropriate for people as their needs change. It's transportation, it's economic security, it's property taxes, which New Jersey, if you didn't see last week, it was announced we have the highest property taxes in the country. And it's the overall cost of living in New Jersey. And what we know from the age-friendly community is what's good for older adults is good for everyone. So I'm just going to say it over and over again. We are not competing for resources. We are building better for the future. Next slide. So what we've done so far in our campaign is we have our steering committee, the logos I had up front. We've met with 6 of the candidates. We are making plans to meet with more. And once the primary happens, we're going to pivot and have a more active campaign. We have a website if you guys want to check it out, lifelongstrongnj.org. And on it, we're tracking New Jersey news that's related to aging. It's been eye-opening for me to see how much is out there, what communities are doing on the local level, the county level, and the state level to, that is related to many aspects of aging and helping their older residents. And we're building partnerships. And we invite you to partner with us in this. This is an all hands on deck, all inclusive effort that will have long-term implications for New Jersey. Next slide, please. So what can you do when you join? I'm going to show you our website again in a moment, but you can sign up for our newsletter and see what's going on. We ask you to take our pledge to join us. So our pledge asks for aging to be considered in all policies in New Jersey. We also want your input. We want to know what your priorities are so we can help elevate them and share them. If there is something that you are working on or something that you're struggling with or you feel is a top priority, tell us. We want to include it, and we can share that information in blogs. We're going to be putting on op-ed. We even have a ghostwriter for you, so don't feel intimidated. But we want to share what your needs are and what your priorities and your work is. We ask you to cross-promote Lifelong Jersey so that we can help get the word out and share with us and with others how this effort and how a multi-sector plan would benefit your organization. We are going to be having group letters after the primaries. So, and we will never put out anything without you seeing it before we put your name on it, but consider signing group letters for the important issues and let us highlight your work. As I said, we can do blogs and op-ed letters. Let us help you achieve your goals. We are in this together. This is a collaborative and inclusive process so that we can really reflect the needs of New Jersey. Next slide. So here is the QR code. If you want to scan that to get to our website or look at lifelongstrongnj.org, go through it, see what is happening. You might not even be aware of what's happening at your local level, but there's so much activity related to aging right now, and we need to harness that and capture it and use it to go forward. So I hope you will join us. We are going to be talking about this at the upcoming New Jersey Advocates for Aging Well conference on May 16th. I think almost all the steering committee will be there to meet people, but we are here, we are listening. Feel free to reach out to any of us to learn more, and we hope that you're going to join us in this journey. Thank you, everybody. Now, I'm a real Jersey girl, so I know I talked fast and I did get through all of that, but I'm going to turn this over to Katie Squires.
Thanks,
Thank
Kathy.
you, Katie. And we'll see if you can keep up with me. I know you're not a native Jersey girl.
No, I am a native. I just left for grad school, but I am a born and bred Jersey girl. So I will do my best to speak quickly. Good morning, everybody. Thank you to the Rutgers Hub for Aging Collaboration and the New Jersey Advocates for Aging Well for convening this program. It has been amazing to hear from all these speakers. My name is Katie Squires, and I am Associate State Director of Advocacy for AARP, and I oversee our age-friendly work as well. I also had the honor of leading Montclair's age-friendly work from 2014 to 2021. So this program has been a wonderful opportunity to reflect on what has been accomplished in the more than 10 years now that New Jersey and its communities have been undertaking age-friendly work. Today, we heard inspiring stories, we shared valuable insights, we recognize the efforts of those who have dedicated themselves to improving the lives of older adults in our communities. And I just want to say that the formula for what makes a community age-friendly isn't particularly complex. For the most part, the features and needs are fairly simple. And as Kathy mentioned, they benefit everybody. In an age-friendly community, people of all ages can go for a walk, cross the street, ride a bike, get around without a car, live safely and comfortably, work or volunteer, enjoy public places, buy healthy food, find the services we need. The list goes on and on. The goal is always to make changes so that we can live comfortably in New Jersey for our whole lives. But our journey towards a more age-friendly New Jersey isn't over, as Emily alluded to. In too many New Jersey communities, it is impossible to get around if you don't have a car, and the rising cost of housing and utilities force New Jerseyans to make difficult decisions. So making our state more age-friendly is a continuous effort that requires collaboration, like you've heard about here, innovation, unwavering commitment. And we couldn't have gotten here without the efforts of so many of you here in this virtual space. So thank you. As we leave here today, I do urge each of you to take action in a way that might be new to you. So maybe you can advocate for policies and practices that support New Jerseyans as we age. Maybe you can engage with your local leaders, participate in community planning, or maybe volunteer your time to initiatives that promote age-friendly communities. Big lasting change doesn't happen overnight, and it takes a village. And so I want to thank you all for devoting your time and expertise to making New Jersey more age-friendly. How was that for speed, Kathy?
Katie, thank you so much. I can't think of a better note to end our formal presentation on than that. And thank you to everyone for all of your comments. We're now going to have invite all of our speakers to join our spotlight space in Zoom and have Dorothy Sanders from New Jersey Advocates for Aging Well lead our Q&A segment before we do some final announcements and adjournment.
Hi, great. Thank you all for being here this morning and kicking off this age-friendly and Older Americans Month with us. After all that exciting information, we know we've given you a lot of information, lots of faces, some old, some new, with emerging ideas and shifting priorities and advocacy and philanthropic issues. I'm sure you've got some burning questions for the panelists and for the presenters. So if you want to feel free and just kind of raise your hand feature, I think we'll be able to get you from there. We have so many pages. I got to kind of flip through it and see if we have any.
Natalie, also feel free to chime in. I think there were some questions in the chat and you were monitoring that. If you want to read them, that's okay too. And Olive, we're trying to spotlight you as well, but the Zoom is not allowing us to add your spotlight, but please feel free to unmute and respond as well at any point.
Hello.
Yes, we will have the slides available on another website to check out, agefriendlynj.org. I'm sorry, yes, agefriendlynj.org is the website for the Age Friendly North Jersey Alliance. And please follow it, check it out. Information for it is included in the monthly NJAAW newsletter, but on it we have events and we also have a lot of resources, especially for the new communities to look at. We will be putting these slides under this event, and we have their the events and recordings going back for more than 2 years. We've had so many great speakers over the years with great advice, so please check it out and you know, if you're able to share it with other people too.
Emily, I see a question from Susan Hoskins. What efforts are being made to make age-friendly New Jersey resilient as states are facing huge impacts from federal funding cutbacks? So that's a tough one, but thank you, Susan, for asking the question.
And I think we're kind of all struggling with that, both nonprofits as well as individual corporations and in our own lives, just kind of deal with everything that's being kind of thrust at us from the administration. One of the things that we're going to pull together for you is a list of resources that really address these concerns and what you can do as individuals to reach out and who you can reach out to. I mean, many of us at nonprofits, non-political, as Kathy loves to say, aging is not political. So we do have a bunch of information that you will soon be receiving with respect to certain things that you can do to help blunt the impact. And right now, we don't even know how far reaching the impact is going to be, but it's something that is top of mind for all of us.
And I think also that because of the uncertainty, and let's say we're going to have uncertainty for, I saw a magazine cover 1,314 more days, at least this is more reason than ever for New Jersey to have a multi-sector plan, to have a long-term 10-year strategy for not only preparing for our shifting demographics, but for everything that affects aging. And if we are at risk of losing funding coming from the federal government, that doesn't take away the need. Cutting a budget or eliminating or closing an office does not resolve a problem. It does not take away the need. So with a multi-sector plan, that's something we can build in and build up our resiliency and plans, even if New Jersey has to go it alone on some issues.
I would add that if our communities are stronger and able to communicate about the resources that are available, then older adults can reach out to them. One of the things we find is not all the resources are being used at this time. And if we find that these resources are valuable, we need to share that with those at the state level and make sure that those voices, our community's voices are heard.
I would add just one more thing. Even though aging is not political, healthy aging requires policy to support it. And so I think that we have a lot of really strong nonprofit organizations around the state of New Jersey that are really good at advocating in Trenton and putting our thoughts together, our efforts and our energy with groups around the state that are doing that to protect what we know is helpful to aging is one way to be involved right now. Referring to things like the Medicaid fact sheet that Katie shared from AARP and other kinds of issues like that we know can make it easier to age or can make it really hard. We need to back the changes that we know are important.
And even before, go ahead, Emily.
Oh, okay. I'll just jump in real quick. I was going to say, kind of from an academic perspective, we think about in the age-friendly communities movement, apropos to this really important question, this tension between empowering local communities, like we want local decision makers to feel responsible and invested and excited in doing more on aging. At the same time, we don't want devolution, which is basically where higher levels of government devolve responsibility and funding for critical services to lower levels. So that could be the federal government to state, state to county, county to local, et cetera. So I think keeping these kind of both and perspectives in mind of the heightened importance of age-friendly community work in this current context of the federal infrastructure in particular dissipating in some ways or planned getting smaller. But at the same time, staying active, and again, this theme of advocacy and education and outreach of really using local muscle to slow things down, partner across levels, partner across sectors. So just holding both those spaces. I know Katie wanted to jump in. I also want to make sure if Melissa wants to chime in here too, that she has the opportunity as well.
Just briefly saying, as much as you can also reach out to representatives at the federal level as well. That's always important. Before we get cuts to the state, there's still time to reach out and use those talking points about the impact of Medicaid in New Jersey, for instance.
And we do have a question also from Rosemary Marchetto.
Thank you, everyone. Can everybody hear me?
Yes.
Okay. So my name is Rosemary Marchetto. I'm a prevention specialist with the Center for Alcohol and Drug Resource. I work primarily with older adults in Bergen County, and I have a counterpart named Donnie who works with older adults in Passaic County. This is not so much a question as much as it is information. We do work on grants. We are a non-for-profit, so grants and donations. Our organization is highly segmented. So the older population is there's recovery, there's NJAAW, and it's very, very segmented. What I'm seeing here from that astounding information of 30% of older adults are caring for our children. We have at the center a unique situation where we can cross populations. Now, I don't know if this is an opportunity for a grant. I don't know how this would work, but we do have a very large opportunity here at the center to work with multiple populations. So if that's of any interest, I'm just putting it out there. Yes, I do work with older adults, but the center itself works with every age population. We're in grammar schools, we're in high schools, we're in senior centers. So I'm just letting you know who I am and whatever I can do, whatever information I can give you guys or how we can work together, I'd be happy to discuss.
Fantastic. Thank you, Rosemary. And if you can put your contact information in the chat, if you haven't, that'll be really helpful for us as well.
Absolutely. Thank you, everybody.
Great. And Melissa, were you going to add some additional comments as well?
No, thank you.
I just put in the chat for Bergen County leaders, and this goes to show how county leadership is also super important. Someone mentioned Janet Sharma with Age Friendly Inglewood for many years as part of the grant making program. She and other Bergen County leaders have come together to create a Bergen Roundtable series that's about every other month. They meet in person, and it is for largely service providers and other advocates, not just exclusively in aging, any population, any organization that touches older adults' lives in some ways. To come together and network and share information. They usually have a speaker. I think the next meeting is May 30th in Maywood. That is a wonderful model, this grassroots development in Bergen County. Encourage other counties represented here to think about forming their own networking in person, coming together around the theme of aging. And Rosemary, if you're not connected already with that, I'm happy to help you connect into that structure and others as well.
Thank you.
And Janet would have been here this morning, but she is also out advocating and sharing awareness on age-friendly initiatives in Bergen County and New Jersey. She's basically everywhere.
I'll say too, it's so exciting that we have counties in the state's age-friendly grants program as well. So a lot of the work through age-friendly North Jersey has been rooted in municipalities and expanded out to the county level over time. But there's such great opportunity now for more and more counties to step up. We have age-friendly Somerset. Oh gosh, I'm gonna mess it up. Age-friendly Bergen County. Now we have age-friendly Ocean County. Age-friendly Camden County, I think. So we really do need multiple levels of this work. And it's also a testament to the movement's maturation and further development to see county governments as well step into this space over time in our state.
So please don't forget to kind of check out the chat because there are lots of interesting things and resources and links there. I saw one link that was asking something about libraries, and although I can't find it now, I'm really happy to mention that Age Friendly North Jersey and NJAAW will be hosting sometime later in the fall a collaboration with libraries in the northern New Jersey area. As Kathy probably mentioned during her presentation, libraries are one of the most popular places where older adults congregate and where they meet and where they feel comfortable, where they can gain additional knowledge and information. So that we're trying to incorporate libraries even more so in the age-friendly initiatives that we put forth.
Dorothy, thank you. We have, I think, time for one more question before we wrap it up. And that was Joan had in the chat about affordable senior housing as a huge problem. I know it's going to take more than 2 minutes to address such a big question, but I just wanted to acknowledge it and ask if anybody at the local level, any of our speakers statewide wanted to talk about how that relates to age-friendly community work.
I can speak somewhat on it. My name is John Watkins. I'm with the Linden Social Services Department. I'm on the affordable housing, committee that we created here. We're trying to bring more affordability and more affordable housing here in the city of Linden. We do have a senior housing or Linden Housing Authority, which has senior housing available. There is the opportunity for senior housing, and there is a waiting list as well. There's an opportunity to do more. the state, I believe, is trying to get people to do what's called ADUs, accessible dwelling units, be built, and also present people with co-ops. But people want to be, have respect in their aging, and also want to be, independent as long as possible. There's opportunities. I don't really want to tell people how to, how they want to live and how they want to be, but people want to stay here and be comfortable with how they want to age. And they should have a right to age and be safe in their environment and be where they want to be and be happy in their place. But people do get pushed kind of out, and we're experiencing that right now where people are kind of getting, pushed out by prices, displaced. And we're trying to, as best as possible, combat that with the best means that we can. So I'm open to any other suggestions, and I'm also going to put my email in the chat as well. If anyone else wants to reach us here, and I'm excited about the opportunities here to network with the aging department here. Thank you.
John, I thank you. I just want to comment that, housing is another pillar of a multi-sector plan on aging, because, we have the official affordable housing, and we know that's a crisis, and we know that there's a shortage. And we also need housing that is just plain affordable. My oldest is 25 now. He and his friends graduated from college. They're not coming back to New Jersey. They cannot afford to buy a first home. They cannot afford to live in New Jersey. So what is good for the 80-year-old is good for everyone. We need more housing options that work for everyone. And people who are housing insecure all the way through their lives, it is not going to get better as you age. So housing is one of the most important issues for older adults, but it really does impact everyone. And we learned when we met with the candidate Mayor Ross Baraka from Newark. In Newark, they're encouraging ADUs for people of all ages. Your adult children can live there. First-time homeowners could buy or rent it. It really opens up to a lot of people, and it's not just something that impacts people over 60. It's something that impacts everyone in the state. So it's important to really keep up the pressure and keep the conversations going on a wide range of housing options.
Great. So we're gonna go to our announcements, but EJ, did you want to chime in?
Oh, yeah, I just wanted to mention, because I wanted to echo what Kathy said, that it's, it's across generations, but I'm actually right now in Washington, D.C. at the CLPHA, so the Center for Large Public Housing Authorities Summit for Housing is. And I think one of the main things that constantly is being echoed is there's a responsibility for people who are considering building senior housing, because they need to recognize that acuity levels are not changing. They're actually, people are going to become more dependent. And so, yes, there is a need for affordable housing across all generations, but for anyone who specifically is developing senior affordable housing, recognize that we need to build supportive options in place also. So making sure that there is, supportive housing services brought on site as well.
I think that's a great segue. Thank you, EJ, toward one of the big events on this announcement slide. On May 21st, the Supportive Housing Association of New Jersey is having another virtual event on aging and supportive housing roundtable for municipalities, which really speaks to what can local decision makers be doing in this space. So I'm going to go ahead and turn the mic over to Kathy to close us out.
Okay, thank you. I know we have covered a lot, and I think we do tend to do this in our events because there is so much that relates to aging, and so much of it is important. So, I'm just going to say happy Older Americans Month. We talked about the threats of federal cuts, and at this point, the ACL, which runs Older Americans Month, may be dissolved into the rest of Department of Human Services, which is something that I hope all of you protest and try to keep it. But now more than ever, it is time to really flip the script, to look at things differently, to not only stand up for aging, but to fight for aging. And we encourage you to stick with us and join us through the Age Friendly New Jersey website, we hope you join us for the Lifelong Strong New Jersey campaign. We have so much work to do, but it's good work and it's going to have good results, and we really can't do it without you. And I also want to say, I know it's been so stressful with you know, threats of cuts, offices closing, so many things that impact you and your work. I just want to tell you that we appreciate you. We appreciate all that you're doing for older adults. Your work is important, and we are with you for every step of the way as we navigate these, you know, constantly changing times. So thank you for joining us. Have a very happy Older Americans Month, and let us know what you're doing to flip the script. We hope that we see you all again soon. Thank you.
Thank you, Kathy. And again, thank you to everyone for coming together. We just want to note, when you close out your Zoom, you will see an event satisfaction survey pop up. If you could take a minute or two to let us know about your experience of this event. It's always helpful for us to hear directly from people. And wishing everybody a great start to May. Is Older Americans Month. We all flip the script. We're doing it now. We'll keep doing it. And I'm looking forward to seeing you next time. Thank you.